This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Medical Center in Oshkosh and we're in a department hopefully you never have to visit. It's the emergency department. Now we're going to be speaking with Tracy Warren. She's a registered nurse. She's going to let us know when it's appropriate to come to the ER and also what this department has to offer the community. Tracy, thanks for joining us today. We're in one of your trauma centers here at Aurora in Oshkosh. Tell us a little bit about what it takes. What do you have to do as a registered nurse to become a registered nurse and work in an emergency room?
Well, to work in the emergency department is kind of a specialized field in nursing. We do recommend at least 1 or 2 years of medical surgical experience for the nurses right out of school to get some good experience in their assessments down up on the medical surgical floors. Once they come to the emergency department, our nurses are all trained with advanced trauma life support skills, as well as pediatric advanced trauma life support skills, as well as some additional trauma certifications that they get to make sure that we know how to treat every patient from a heart attack to a trauma patient to a stroke patient. So it really is a specialized field, but we definitely give them the skills that they need to be successful in our department. Yeah,
you say it's important for everyone to kind of get that emergency room experience, but to stay on an emergency room, I would imagine that takes a special person to stay on, and you've got a great staff here.
It really does. We do have a big team environment here in our emergency department. Over the last couple of years, we've brought in a lot of new faces to the department, and we really look at it as a family, that us as a department is a family, as well as the patients coming in is an extension of our family. We want to treat everyone how we want to be treated and definitely focus not only on clinical excellence, but also great customer satisfaction, patient satisfaction when they come in as well.
Yeah, a great staff here, and you guys have some great facilities to work with as well.
We do. We really have a great facility here. We have 18 rooms in our emergency department and 2 trauma rooms. The trauma room that we're in right now is set up not only for regular trauma adult patients, but also our pediatric population as well that could unfortunately come in an emergency that we would need to care for.
Yeah. What type of cases are you typically seeing in an emergency room?
You know, that's the beauty of it, that you never know what's going to walk through the door. You get a little bit of everything. You get the tooth pain all the way up to a heart attack, an active heart attack, or a trauma patient that unfortunately got in an accident on Highway 41 that's right, you know, up the block. So a little bit of everything. You're kind of a jack of all trades.
Yeah. So Tracy, typically, you know, if you end up in an ambulance, you're coming to the emergency room, no doubt about that. But you mentioned, you know, tooth pain, things like that. When is it appropriate for a person to come to the emergency room?
Well, the patients that we definitely want to come over to the emergency department are patients with chest pain, any type of males or females. And females definitely get some non-traditional signs of having chest pain, where they'll get some jaw pain, they'll get some arm tingling, or even some indigestion. It gives us a high suspicion of cardiac injury with the female population. We also like our abdominal pain patients to come on over to the emergency department because there's a whole bunch of things that go along with abdominal pain, as well as our stroke symptoms. So any type of numbness, tingling, facial droop, come to the emergency department. Those minutes are valuable.
Right. And you know, a person walking in off the street or a car accident, something like that, you always kind of expect that. That's kind of an everyday event that you experience. But I would imagine in an emergency room like this here at Aurora, you guys have to be ready for any kind of catastrophic disaster that might happen in the area.
Absolutely. And given our location and our events that we have in the city of Oshkosh, in the last year we have really taken that tremendously seriously in our facility. This past summer, Winnebago County as a whole did a tabletop exercise involving if a plane would go down in the crowd at EAA, how would the emergency departments handle it? How would our fire departments handle it? What's our plan? So we've really branched off from that to make sure things are like a well-oiled machine, that we know what to do, what our next steps are, what we need to do for our patients, and where we need to get them.
Right, and I would imagine with so many events coming to Oshkosh that you have a lot of different challenges involved with so many visitors from actually around the world.
Absolutely. Our volumes definitely do increase over EAA and our Country USA and Rock USA, and it really is fascinating for us as care providers to really learn about these people and where they're coming from, what brought them to the area, and you know, try to get them the best health care that we can.
Right. You deal with ambulance services, but also helicopter fly-ins as well, don't you?
Absolutely. We are really fortunate in our area of the state to have quite a number of helicopter services. We have Flight for Life, which is based out of, they have a base in Fond du Lac for us, and then we also have Theta Star out of Theta Clark and Appleton, or Nina, I should say, and then we also have Eagle 3 out of Green Bay. So we really are fortunate in our area of the state to have so many air medical people to get people to definitive care that we can't provide them here.
Yeah, you can provide service for so many people around the surrounding area as well. Anything new in the emergency room?
We have some very exciting changes in 2012. We have a new emergency department manager. Her name is Bonnie, and she comes with 20 years of experience in management as well as bedside care, so she's been phenomenal to work with. My role here in the hospital has changed a little bit. I've been with Aurora for 13 years, so I love working for Aurora, but I've been the supervisor here for about 2 years, and then in spring took over the trauma coordinator position as well. So I kind of have dual roles. So Bonnie and I work very well together and have a great team of leadership as well as bedside staff. Some of the other initiatives that we've really been working on, changes for our department, is really honing in on as well as clinical excellence with our caregivers, as well as patient satisfaction, and making sure they have the information that they need while they're here. We may do this a million times a day, every day, having chest pain patient after chest pain patient, but you coming in as a patient, you've never done this before, and we need to fill in those gaps for you. Who am I? What am I doing? What's going to happen next, and what are you waiting for? Those are the main things that patients need to know.
Hopefully we never have to meet you in a professional standpoint, but if we do, we're in good hands.
Absolutely.
Thanks for taking some time with us today.
Absolutely. Thanks for having me.
Now, if you're experiencing any of those symptoms that Tracy was talking about in an emergency situation, you need to call 911 immediately. Otherwise, if you have any other questions about the ER department here at Aurora in Oshkosh, you can give us a call at 456-7400. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.